Well, Dr. Esen Okorebi, GP Registrar, Worcester Royal Hospital, England, joins us for more. Thanks for joining us on the program.
Thank you very much.
All right. I mean, you're also a sports enthusiast, and you probably know there's mixed feelings about the Tokyo Olympics and the rising cases. Can it be helped if countries are opening up, participants told to vaccinate and test from time to time? Isn't that an example of getting to live with the sort of new normal the coronavirus has presented?
Absolutely. And that's what we've seen with the Tokyo Olympic Games, where in the last couple of weeks, they have recorded the highest number of COVID cases. So about 149% increase this week compared to last week, with about 2,800 persons in Tokyo testing positive for coronavirus. But with the athletes in Tokyo, they go through very strict COVID-19 testing, and all that have been found to be positive are asked to quarantine and not compete with the sports. And that's clearly living with the virus. And that's what we are seeing even in the United Kingdom. Before people can go to watch sports, they should show evidence that they've either tested negative for COVID-19 or that they have been double jabbed with the COVID vaccine. So I think we are gradually coming to that point where as countries and as individuals, we are beginning to live with the virus and taking measures daily in order to reduce the transmission of this virus and also enjoy doing the things that we love to do.
What interesting times these are. So if we come to England now, the number of COVID-19 patients in British hospitals has sort of steadily risen. Also the highest since March, we're being told, following a spike in cases. Yet the number of new infections has also fallen each day for the last 7 days. How do you interpret the data?
Well, it is true that the number of hospital admissions are, on the rise, and the infections are falling, as well as the death rate has remained low. It is difficult to interpret these results because, as we know, the data that we get from hospital usually lags behind in terms of the data with people that are infected on a daily basis. So in the next couple of weeks, if we see the hospital or hospitalization still rising, then that poses a problem for us in the UK. As you're well aware, in the UK, quite a lot of restrictions have been lifted for the public. And if the cases in hospital continues to rise, then it might be a concern for the government to revisit some of these restrictions that have been eased. Another point to note might just be that the reason why the numbers of infection is going down might be because schools have closed. So students usually transmit the infections more during the school period. And in the last couple of weeks in the UK, we've been on the school holiday, and some scientists think that that's the reason why the infection rates are low compared to a couple of weeks ago.
Let's talk about the so-called pingdemic. What's your take on it? It seems that a great many people have been asked to self-isolate recently, and this could have a direct impact on transmission.
Right. I mean, the pingdemic, as some people would call it, I think has overstayed its time, really, especially with the easing completely of the lockdown. So the pingdemic is a system where people get pinged on their telephone when they have come in contact with people who have tested positive for COVID-19 in the UK, either through visiting a bar, a restaurant, or coming into contact with people at workplace. And when you're pinged, you then have to self-isolate for a period of time, usually 10 days, and then you can then return to work. But with the complete lifting of the lockdown, it will become difficult to carry on with this. And the government has announced that from the 16th of August, people who have been double vaccinated, people who have had 2 jabs, would no longer be required to self-isolate when they are pinged by the NHS Test and Trace app. As we also know, it's been very stressful for businesses as well as the hospitals, because lots of people have been pinged and they've had to self-isolate, meaning that the pressure on the NHS is even more because the workforce are self-isolating. Same thing applies to restaurants and other businesses when workers are asked to self-isolate because they have been in contact with someone who has tested positive for COVID-19. So those rules are changing, and people who have received their vaccines, except they test positive themselves, will no longer be required to self-isolate in the United Kingdom. And I think that's, once again, moving away from the pandemic and getting back into our normal lives.
Right, Dr. Sinukorebe, we always appreciate your time on the program. GP Registrar, Worcester Royal Hospital, England. Thanks for joining us.
Thank you very much.